If your acupuncture schedule is filling up and you're wondering how you are possibly supposed to fit in any more patients, this video is for you. One of the biggest mistakes that acupuncturists make is trying to increase patient volume without making sure that their systems are in line first. And eventually, that is going to lead to burnout, running behind schedule, charting backlogs, frustrated patients, and lowered quality of care. The good news is that there are solutions, and I'm going to walk you through a couple. My name is Dr. Amy Abelard. I'm with Acupuncture Practice Systems, and over the last 18 years, I have grown and scaled my business from a solo practice into a multi-provider massage and acupuncture clinic with 24 employees. One of the most common questions that I see from acupuncturists is, how do I continue growing without working myself into the ground? Because eventually there comes a point where simply adding more patients to your schedule is no longer sustainable. And really, there's only two ways to increase your patient volume. Either you see more patients or somebody else in your office sees more patients. That's really it. Most acupuncturists initially try to solve the problem by seeing more patients themselves. This usually means adding another treatment room, working longer days, working more days per week, or sometimes shortening breaks or skipping lunches just to squeeze patients into the schedule. And I am so guilty of doing that in the past. But eventually you're going to hit a wall because you are human. You need sleep, you need food, you need family time, you need vacations, not to mention recovery, right? And you cannot endlessly increase patient volume through personal effort alone. So, what are your other options? Inside the full training, which is part of Acupuncture Practice Systems, I break down all the different approaches that you can use. One of those is delegating administrative tasks. It is one of the easiest ways to create patient capacity, and that is by removing tasks from your plate that don't require an acupuncture license. This can be things like answering phones, laundry, scheduling patients, flipping over your rooms, restocking treatment supplies, ordering inventory, office cleaning, insurance verification. Delegating can free up hours of your time every week, and those hours can be redirected towards patient care instead of adding on to the end or the beginning of your day. So you're swapping the office admin tasks that you've been doing for patient treatment time instead of lengthening your treatment days. If you do decide to hire help, there are systems that you're going to need in place for that too, right? Hiring is only effective if the person knows exactly what they're responsible for and how to do it. And it also helps to have found a great candidate. Inside Acupuncture Practice Systems, I include hiring documents, job postings, interview forms, onboarding checklists, training systems, receptionist, employee manuals, opening and closing procedures, and operational workflows that we use inside our practice daily. And when we update ours, I update it in the membership as well. Because when you hire without systems, often it's going to create more problems than it solves. And I've experienced that in the past as well while I was working on building these systems. Another option is going to be to accommodate more patients by hiring another provider. And at some point, that will either make sense for you or it won't. But again, the success of that is going to depend on having proper systems for your hiring and your onboarding and your training, and making sure that you are managing consistency across the board between you and the other acupuncturist. All of this is stuff that we cover inside of the Acupuncture Practice Systems membership. So if you're currently trying to grow your practice and you're wondering, what is my next step? I have created resources, systems, templates, and trainings specifically to help acupuncturists navigate these decisions. Inside Acupuncture Practice Systems, you will find the hiring documents, onboarding materials, operational procedures, and the business resources and coaching that are required at every stage of growth, whether you are a solo practitioner all the way up to a multi-provider clinic ownership. You can click the link below to learn more about Acupuncture Practice Systems and see which membership level is the best fit for where you're at in your practice journey.